Well, Mark Cuban is at it again. He is disrupting another market, and this time it's the pharmaceutical industry. And the question is, will this have any impact upon Medicare Part D plans? I'll show you that in this video. Okay, to begin with, Mark Cuban's new venture is called Cost Plus Drugs. Cost Plus Drugs. Now, keep in mind, Cost Plus Drugs is primarily for generic medications. Now, there may be a time when they add brands to this business model, but for now, it's just generic medications only. All right? And again, most people are taking generic medications, and most brand names have a generic alternative or a generic equivalent. So we're dealing with generic medications. So what is it that he has done? So let's talk about what his business model looks like and what's been happening prior to that. So right now, outside the Cost Plus business model is this. You have the manufacturer, of course, that makes the medication, and that manufacturer is going to get this drug to market. Now, when we talk about going to market, we're talking about a pharmacy. Now, this could be a retail pharmacy, it could be a mail order pharmacy, and then it's going to go to the consumer, okay? And so presently what happens is there are several steps between the manufacturer and the actual pharmacy. When I say several steps, I'm saying there's some profits that happen because as it goes through this chain, everyone who touches this medication is going to make some money off of that. And so we have several markups along the way before we actually get to the pharmacy. And then, of course, the pharmacy has to make a profit, and then it goes to the consumer. All right? And so what Mark Cuban is doing in this business model is this. He is working directly with the manufacturers of the medication, and so they go directly to Cost Plus, right, and then to the consumer. So what happens is there are no middlemen between the manufacturer and Cuban's company at all. And so what they do is they take the actual cost of that medication with full transparency, and they add 15% to the cost of that medication. And so the consumer is paying substantially less money on some medications. Now, again, some are going to be a greater discount than others, but the example that I read about that was very interesting. It was actually a medication that's an infection medication for hookworms. And so what happens right now, if someone didn't have the Cost Plus system available, that medication was $225. So from manufacturer to the customer, a tremendous amount of money. But in Cuban's model, what happens from the manufacturer to the consumer, that same medication was $20 copay. And so what is that? Less than 10%. So there's 90% of the markup that's typically allowed of these medications has now been eliminated through the Cost Plus system. So that's a wonderful, wonderful thing. So as long as we're on a generic medication, so what we're talking about here is just paying cash and sometimes substantially less money. And so what I want to talk about next is what impact will this really have on Medicare and Medicare plans? So let's do this. Let me go to a new screen and let's talk about how Part D plans work. Now remember, if you or your spouse are still working, and even if you're eligible for Medicare, if you all are working and you are covered by a group plan that has at least 20 employees or more, you don't have to do anything with Medicare. So when I'm talking about Part D plans, this would be for people that are already retired. Maybe they're on a COBRA plan, or they're in a small group of 19 or less. In other words, I'm just talking about people who have to go on Part D plans, because if you or your spouse are still working and there's 20 or more that are in your group, you don't have to do anything with Medicare. You don't have to have A, you don't have to have B, you don't have to have a drug plan because your employer-provided plan has credible drug coverage. So this conversation really is for those of you that have to be on Medicare Part D plans because you or your spouse are no longer working. All right, so I want to make that real clear. Secondly, hey everybody, just real quick, I want to remind you to hit the subscribe button and ring the bell below. Just recently, I had a lady call me and she was scammed 3 times to switch her plans in 1 week just because she didn't have an education. We upload 3 videos every week, and our content is designed to give you the education that you need so you will not make those kind of mistakes. If you subscribe and ring the bell below, you'll never miss an upload. Hope you enjoy the rest of the video. When we talk about Part D plans, here's the way we get them. You have 2 systems that we use when we use our Medicare benefits. One of those is to stay in original Medicare A and B. But of course, Medicare has gaps. So what happens is people add to that method of coverage, they add what is called a supplemental plan. All right. Now, this supplemental plan has to do with inpatient and outpatient, as well as professionally administered prescription drugs, professionally administered drugs. And so we have a supplemental plan. Most people today either get an F plan, a G plan, or an N plan. I'd say the G plan is probably the most popular today. Now, we do have some drug coverage with A and B and supplemental plans, but only, again, professionally administered medications, outpatient facilities, inpatient stays, anything that's taken in the hospital or outpatient clinic, or infusions where you have to go to a doctor's office to get that. Those kind of things are covered through A and B and the supplemental plan. But when I stay in this system for the meds I take myself, my self-administered medications, I have to have a separate Part D plan. Okay? And so this Part D plan also has a premium. Right now, the average, I'd say, is probably about $30 to $35 on a monthly basis. And so in this system, what we're doing is we're selecting a Part D plan for the medications that we take. And so when we select that plan, it's going to be based upon the meds you take as well as a pharmacy that you would like to go to. And so in this system, I pick a plan, and that plan is written for 1 calendar year, and that plan can be switched if it needs to be switched the next year. And we actually just came out of this period called the open enrollment period. And this lasts October 15th through December 7th. So I pick a plan, it's a calendar year plan, and if my meds go up next year, or my meds go down, in other words, something's changed with my needs and I need to change my plan, I can do so anytime between October 15th to December 7th. And the new plan that I select during Medicare's open enrollment period will go into effect the following January 1. And again, I'll be covered by that plan for a year. So this is one way in which you can get your prescriptions covered. You stay in original A and B, we have a supplemental plan, and we have a separate drug plan. All right. And again, that has a premium to it. Now let's talk about the second way in which you can get your medications covered. And that would be if you decide to take a Medicare Advantage plan. Medicare Advantage. Now, Medicare Advantage plan are actually called C plans. These are also called replacement plans. And so when you go on Medicare and you make the decision how you're going to use your Medicare coverage, it really boils down to these two choices. Either you stay in A and B and get a supplemental plan, or you get a replacement plan called the Advantage plan, and now you have a private health insurance company that's replacing Medicare for you. All right, so here's what happens. Medicare Advantage plans are for inpatient, outpatient. Then we have the right with the Medicare Advantage plan to add a prescription drug plan. This is the Part D component. That's why we call them MAPD plans. So this is inpatient, outpatient, and a prescription drug plan, all built within one. Now, keep this in mind, and that would be this. If you are retired from the federal government, you're retired military, therefore eligible for TRICARE for life, or you are a veteran that has VA benefits, you do not have to have a Part D plan, because you have another source to get your medications that are credible. You can get it through your FEHB plan. It could be GEHA, it could be Blue Cross, it could be TRICARE for life if you're retired military, or through the VA system if you served our country but didn't retire, but you're still eligible for VA benefits. You can get your drugs through those systems, and they're credible, which means then what you can do is get what is called an MA-only plan. And there's some benefits to that. I don't want to go into that to this video because I'm restricting this really to the drug component, but I want to make sure you know that, again, FEHB, TRICARE for life, and veterans, you can do a Medicare Advantage with no prescription drug coverage, and there's some nice packages for that. But for the majority of you, you're not FEHB, you're not TRICARE, you're not VA, you're going to get a prescription drug plan as built in as part of your coverage with your Medicare Advantage. So they add that prescription drug plan. All right. So the point is, we have two ways in which we can get our medications covered, either standalone drug plans, if I have a supplemental plan, or a Medicare Advantage plan. Okay, so both of these systems are going to work the same way as far as your out-of-pocket expenses. So I'm going to explain that, because really this is what makes drug plans very interesting, and I'm going to apply some of this to Cuban's new program as well. Okay, so let's talk about prescription drug plans. First off, every prescription drug plan, whether it's embedded in the Advantage, or it's separate if I get a supplemental plan, standalone or embedded, what happens is we have 4 stages. And this just simply means that a medication that you're taking could potentially change co-payments throughout the year up to 4 times, because we have these stages. Now, to kind of get your mind around the understanding of this, is just to do a simple comparison. If you're working somewhere or have in the past, or right now you are, your prescription drug plan at work has 1 stage. And that means they cover a medication and they give you a fixed copay, and that copay throughout the whole calendar year does not change. So if the copay is $5, it's $5 in January, it's $5 in July, it's $5 in December. If the copay is $30, it's $30 in January, July, or December, it doesn't matter. That's one stage fixed copays. When it comes to Medicare, we have fluctuating copays. Why? Because we have 4 stages. So the way to understand this is to know that your drugs, same medication, could change prices 4 times depending upon your stage. So let me teach you the stages, and you'll see how we move through these stages throughout the year. Okay, stage 1 is called the deductible stage. Now, Medicare sets this. The deductible for 2023 is $505. And so some plans, most plans, I should say, charge the full $505. Some reduce it, some put it to 0. But we have to deal with the deductible stage. And all that simply means is when I get a prescription, that prescription is more than likely going to have a copay to it. And that copay amount that I pay is going to be applied to that $505. So let's say I'm on a $25 medication, it's applied to the $505. I'm on a $5 medication, again, it's going to be applied to the $505. Now, the truth is, probably 70% of all people, their medications are so low cost that they're never going to meet the deductible. But let's say I'm on a medication that costs $525, like such as Eliquis or Xarelto or something expensive. Well, that $525 copay would help me to meet my deductible. So if I ever meet the deductible any time of the year, whether it's the first fill or the third fill or any time, that means that I am now done with stage 1. So once I meet my deductible, now I'm going to move to stage 2. Now, the stage 2 by Medicare is called initial coverage. And so the way initial coverage works is this. Every medication that's covered by the plan in the formulary is going to be given a tier number. It's usually a tier 1, 2, 3, 4, or 5. The lower the tier, the lower the copay. So let's say I'm on a tier 1 medication and the copay could be 0. I'm on a tier 2 medication and the copay could be $10, and we'll call a tier 3 $45. So what happens when I'm in this stage 2, I just simply pay my copays. And so they're very, very reasonable copays. Again, some of them are 0 if they're a tier 1 medication. And so we pay our copays here. But here's where things are different than like an employer type of a plan. While we get prescriptions filled, Medicare is tracking the actual cost of the medication, so the full retail cost. Now, as you can see, I'll give you an example. Let's say I'm on a tier 3 medication and it costs $45 copay to me. That medication could be costing $525 retail. I'm paying $45, but that insurance company that wrote the plan is paying the other, $480. But Medicare is tracking what I'm paying and what the plan is paying, so they're tracking that full retail cost. So every time I get a prescription filled, stage 1 or stage 2, they track the retail cost of medication. So if you're taking some expensive medications, obviously, we're going to see this number start to increase. And so what happens is Medicare sets what they call a threshold. And again, I'm talking about retail cost, not your cost, retail cost. And so the threshold changes every year, but in 2023, the retail threshold is $4,660. $4,660. And so, again, that's not what you spend out of pocket. It's combined what you spend and the plan spent. In fact, you spent maybe 25% of this. You didn't spend a whole lot of it. But again, Medicare tracks the retail. So let's look at my example. If I'm on a medication, just one that costs $525 and the retail threshold is $4,660, how long is it going to take to get there? Well, it's going to take about 8 months. Okay, 8 months times this $525 is going to put us at about $300. So we're getting close. So the point is, if I ever reach that retail threshold, whether that's in August or it's in September or it's in February, doesn't matter. If I reach that retail threshold, that puts me then into stage 3. Okay, now stage 3 is called the coverage gap. Now, in layman's term, we call this the donut hole. Right? Because when they started this system in 2006, if you got to stage 3, donut hole meant you had zero help. You actually paid 100% of the cost of your medications if you ever got to stage 3. Now, they realized how bad of a decision that was back in 06, and so over time now they have phased that down to a very reasonable number. We still have the donut hole, we still have the coverage gap, but it's now a little bit more reasonable for people financially. And so now when we're in the coverage gap, all of our medications will cost us a 25% copay. It doesn't matter if it's a brand name or a generic medication, I'm going to pay 25% copay of the actual retail cost of medication. Now let's go back to stage 2 for just a second. Now we know how we move from stage 2 to stage 3, but what I want you to realize, folks, is that probably 90% of all people will never hit that retail threshold. In other words, they're not on an expensive medication that would cause them to be there. Now, some people hit it very quickly. I had a guy I helped recently, had a medication literally that cost $16,000 a month, $16,000 a month. So how long does it take to reach that? Well, he's in the donut hole in 1 week. I had a lady recently that took a medication, it was $23,000 a month. Again, that's very extreme. People that are taking heart medications, usually are going to hit the donut hole. But again, 90% of all people don't. Only 10% do. And now we know why they do, because they've hit the retail threshold. And so that retail threshold is the same whether I have a standalone prescription drug plan, separate from my supplemental plan, or it's included in my Advantage. I will still have to deal with this retail threshold. So if I ever reach the threshold, 10% of all people do. Now I'm in the coverage gap. So I pay 25%. So let's go back to my example. Let's say I'm on Xarelto or Eliquis, expensive heart medication.
Hey, my name's Josh Music, and if you've been enjoying my dad Marvin Music's content, you really need to go to our website, MedicareSchool.com. When you go there, you'll be given the opportunity to download a free 1-hour Medicare Essentials workshop, and it's going to take you all the way from Medicare A to Z. By the time you're done watching that workshop, you're going to know how to enroll in Medicare, when to enroll in Medicare. You're going to know the difference between Advantage plans, supplemental plans. You're going to know how to get drug coverage. You're going to know everything you need to know to get the best coverage possible. So go ahead, go to MedicareSchool.com and watch the Medicare Essentials workshop.
So with the 25% copay, that's going to cost me about, $130 out of my pocket for that medication. So my first fill, I had to pay full cost for it, $525. But then I had a very reasonable copay of $45 because it's just based upon a Tier 3 preferred brand medication, very reasonable. The plan makes up the balance of that. But when I finally hit the threshold, if I do, now I'm into stage 3, and now I pay a flat 25%. So if I'm in the donut hole and I'm on a medication that retails for $100, I pay $25. I'm on a medication that costs $525 retail. I'm going to pay about $130 for the medication. Now, in this particular stage, now Medicare is tracking another number. Again, remember, we're moving through the stages. So this number for 2023 is $7,400. $7,400. Now, number one, that $7,400 is not what you spent. Here's what it includes. It's a couple things, actually. What this $7,400 includes would be if you had to meet your deductible in stage 1, that would go into the $7,400. All your copays in stage 2, so then my example, $45 copays is going into that. And then your 25% copay in the coverage gap is going into that $7,400. But here's also what is going into that $7,400 that is not out of your pocket, and that is this. If you're on a brand name medication, which typically is why you're in the donut hole anyways, generics rarely put you into the donut hole. And so if I'm in this coverage gap, what happens is the brand name manufacturer must discount my medications 70%. So if I'm on a medication that costs $500, that medication was discounted $350 by the manufacturer, but that manufacturer discount is included in that $7,400 number. You didn't pay for it, but they credit it in that $7,400 as though you did pay for it. Okay, so that's really wonderful, which simply means when we look at the $7,400, it's not out of your pocket. You probably spent maybe $2,000 or $3,000 out of your pocket, and that's it. All right, not minimizing the pain of an increased copay, but it's certainly not going to be this huge burden of additional $7,400. That is not going to happen. Okay, so that is stage 4. So if we ever reach this $7,400, and keep in mind some people do, they say about 1% of the Medicare population, what that does is that puts us then into stage 4, which is called catastrophic stage. Okay? Now remember what I said, on all Medicare plans, we have 4 potential copays for the same medication in the same year. They're fluctuating copays. All right? Why is that? Because we had the deductible, we had the initial coverage copays, we had the donut hole copays. Now we're in stage 4 because we reached that $7,400 threshold. And now what happens is we pay the greater of either 5% of the actual cost of medication, or if it's a generic, you'll pay $4.15 copay. If it's a brand name medication, you'll pay $10.35. Okay, so if I'm on a medication that retails for $1,000, 5% would be $50. That's what I'd pay because it's greater than the $10.35. So either $4.15, $10.35, or 5%, whatever is greatest. Now, the good news is if someone gets here, as you can see, medications are very, very inexpensive. And this is exactly the way the system is going to work for 2023. Now, keep this in mind. When we roll into 2024, this catastrophic is going to zero. So if someone ever gets to the catastrophic stage, once we get to 2024 and onward, you would be zero out of pocket in that stage. In 2025, just so you know, unless the legislation changes, we're expecting that the max out of pocket in 2025 for all prescription medications will be $2,000 max out of pocket. Okay, and again, we're yet to get there, but that was part of the proposed legislation that was passed just recently. Okay, but for now, we've got these 4 stages. In 2024, we'll have 3, and then we'll see what happens in 2025. Now, let's get back to Cuban's situation and how that is going to have an impact upon Medicare. So first, you understand this. Number one, you do not have to run medications through your Part D plan. Now, I would highly suggest that even if you take cheap medications, you want to get a Part D prescription drug plan. And the reason for that is because it's not so much because of the meds you're taking now, but if you were prescribed something, and right now you can get it through Cost Plus or maybe GoodRx or some of the coupon system at a very low cost. But if it's an expensive brand medication, number one, Cuban's group's not going to cover brand names, and GoodRx coupons have just a little bit of bearing on brand name medication. So that's why you get a prescription drug plan, because you don't know what you're going to need in the future. Right now, your meds may be cheap, but you could be prescribed something. Remember, I just said, had a gentleman recently, a medication that was $16,000 a month. And he said, Marvin, that medication saves my life every month, $16,000 a month. Now, does he pay that? No. Remember the 4 stages? His first fill for that $16,000 a month medication was $3,000. And then he was in Catastrophic, and now he pays 5% of that $16,000. So what does that medication cost him? $800. $800. Why? Because he had a Part D plan. His premium was about $30. You see, that's why you get a drug plan, just in case you need something that's real expensive. And today you will spend more money on medications than anything else in healthcare. Okay, it's the top of the list today, just because of the very, very expensive meds that are available. All right, and so that's why you get a Part D plan. The good news is, you get a Part D plan. If you have cheap meds, just get a very low-cost plan. There are some plans right now around the country that are between $7 to $10 a month. But again, they're going to cover many, many meds. And so if you need one of those real expensive meds, you'll be grateful that you had a plan. Okay, so when it comes to Cuban's group, Cost Plus, if you decide to use them or a GoodRx coupon, that does not have to be ran through your plan. Therefore, it wouldn't affect that retail thresholds that we're talking about. And again, so it's fine to use that because you're just a cash buyer. Another thing that you need to know about Part D plans, and that's this. Most of the copay cards that you can use on your group plans at work are going to be null and void. I wish it wasn't that way, but it is. Some people have very expensive medications, and they have a $5 copay card. The medication could cost $1,000 a month, and they pay $5. That's because that manufacturer is working with your group plan, maybe your private health insurance plan, to bring that cost down, and your insurance company pays something, and you get a $5 copay. But if you'll read the fine print with those copay cards, they usually say they're null and void once you go on a Medicare plan. All right, and so that's why you've got to have a Medicare plan once you're fully enrolled in Medicare and you're off the group plan. All right, so we can use Cost Plus, we can use GoodRx, probably not going to be able to use the copay cards. All right, and so I like Cost Plus. I think it's wonderful because it could be that if you ran a generic through your plan, it could be $20 or maybe $8. You run it through Cuban's group, it may be $2. So if it makes sense to use them on certain medications, then that's exactly what I would be doing. Okay, all right. So let's go back and let's review real quickly. When we go on a Part D plan, we can either have it embedded with our Advantage, or it's separate if I have a supplemental plan. If I have a supplemental plan with a separate drug plan, I get to choose that plan. It has a separate premium. If I have a Part D plan with my Medicare Advantage, the company has embedded that plan. So they really chose that plan for you. Now, we can change our drug plans on an annual basis. Why? Because they're only written for one calendar year. We have to make those switches between October 15th and December 7th for the coming year. Now, statistically, they say only about 15 to 20% of all people people will need to change their their drug plan year to year because their plan is still going to be in their best interest. It's still favorable. And so some people don't even switch their plan, but you need to pay attention to make sure that you're happy with your drug plan on an annual basis. Okay? And so we can run medications through GoodRx. We can run them through Cost Plus. They will have no bearing at all on those different stages with Medicare because you're just simply paying cash. But I can assure you, when it comes to expensive brand name medications, you're going to want to be enrolled in a Part D plan to make sure you get those at a very, very reduced cost. Okay, and then we talked about the changes happening. Catastrophic goes away in 2024, max out of pocket at $2,000 once we hit 2025. And again, we'd be happy to help you and give you more assistance. But I'm happy for what Cuban has done. I think it's going to be a wonderful benefit, especially for people who have no insurance, for those that want to get a very low-cost generic medication. We're excited about that whole program.